meningitis. And it's a disease where the meninges become inflamed due to infection in the surrounding fluids, which is usually the blood or the cerebrospinal fluid. It's also known as spinal meningitis. It was first discovered by a European professor in 1887. A lot of researchers had the general idea of kind of what the disease was, but he was the first one to pinpoint the bacteria. There are a lot of scientific names for meningitis just because there are so many different strains, and this is several of the common, or like most common ones, but there are obviously a lot more than just that. There are three main types of meningitis. There's viral, bacterial, and fungal. Both bacterial and viral can be transmitted by respiratory and throat secretions like kissing, and bacterial more specifically is with close prolonged contact. Viral you can also get from fecal contamination, so public restrooms or changing diapers or something like that. And fungal is not contagious, but you can inhale spores, which will give you the disease. Viral is the most common, and it's not that dangerous. Usually symptoms last for 2 weeks, and it even sometimes goes unnoticed. Humans are the only host, and bacterial is by far the most dangerous type, so you'd want to watch out for that. These are some of the causes or strains that can lead to the transmission of the disease. A lot of types are found in specific age groups, like in this table here. Viral is usually transmitted or caused by enteroviruses, which can also cause intestinal illness, and most infections occur under the age of 5 with that. And then on fungal, the cryptococcus is most common in Africa. The histoplasma is actually found in bird and bat droppings in the Midwest. And the last one, which I'm not sure how to pronounce, is found in soil in the Southwest. And then you can also get it from just low immune systems that aren't the strongest, and microorganisms that can affect your blood or your CSF. The signs and symptoms are very similar to your common flu, with the nausea, vomiting, fever and chills, and just headaches and stuff, but they do have some unique symptoms like photophobia, which is sensitivity to light, meningismus, which is a stiff neck, and bulging fontanelles, which is the top picture. And that's outward curving of an infant's soft spot. And then the opisthottonos is an unusual posture where the head and neck arched backwards. And that was a mild picture. And like looking at the different pictures, it's kind of disturbing. Typically with diagnosis, it usually begins with a physical exam that indicates that further tests need to go on. One of the main tests that they use is a lumbar puncture, also known as a spinal tap, where they take some of your CSF and collect it and look at the cell count. And if they find strains of meningitis, you need to get treated immediately. A lot of people, no one can tell if they have viral or bacterial or which exact strain that they have, so it's best to get checked. And a lot of times when diagnosing, they grow cultures of the bacteria to make sure they know which strain they have, or they're dealing with. With treating bacterial and fungal, they basically hospitalize you and hook you up to an IV and give you lots and lots of antibiotics. Viral usually just disappears within 2 weeks with no lasting symptoms, so you're pretty much okay with that. If left untreated, you can have everything from brain swelling, shock, seizures, loss of limbs, subdural effusion, which is buildup of fluid between the skull and the brain, and just a lot of bad symptoms, or bad effects. We do have vaccinations for this disease, and most children get them, and then you usually get them when you enter high school, and definitely when you enter college, because you're living in dorm settings, and everything is really close together, and you're more prone to get it. The death rate, there are 1,000 cases in the U.S. per year. 10 to 14% of those cases are fatal, but there are greater amounts in other countries, obviously. Those who survive, some of them, 11 to 19%, with permanent disabilities are those who lose their limbs or have brain damage or anything that you saw in the previous slide. The largest amount of cases is in a strip in sub-Saharan Africa, and it usually occurs during like their dry season, where it goes around and kind of wipes out a large amount of their population. The CDC serves health departments in the U.S. with outbreak concerns, and they have collaborative research with the medical industry and medical schools. And the Meningitis Research Foundation, most of their research projects involve immunization without needles, the study of children with amputations, and the psychological and social effects of living with disabilities from meningitis, and of course prevention or better vaccinations. And here's my website.